Lovely. So welcome back now to our listeners again on Facebook. And James is back. We've given him a mouthful of water, but no more, because we have to continue answering questions at a pace. So James, you ready for part two?
We'll fire away, Ger.
Let's do it then. I am wondering about getting HR3 treatment. I'm 60, asked doctor before, and he told me to go natural route. Prescribed evening primrose oil capsules and soya lectin caps, but didn't help. I've hot flushes and night sweats. What would James recommend?
Well, obviously, Ger, the lady is on the menopausal route there, and sometimes they do get good results from evening primrose oils and the soya lecithin, which mimic what the estrogen does. Obviously, it doesn't seem to be working, and it's definitely worth a conversation with the doctor, because what the HRT does is replaces the estrogen and progesterone that are being lost out of the body, so it eases down on the particular symptoms. So it's definitely going in and having a chat with the GP in relation to that. Now, obviously, there are some areas where you have to be careful with HRT, especially around breast cancer and stuff like that, but the GPs will be very aware of that.
Perfect.
Okay.
James, how can I get my blood pressure down? Mine is very high. I'm on 2 valsartan tablets a day.
Okay, well, the fact that they're on 2 valsartan means that it's probably up there, as in quite high, Jerry.
Yes.
The proprietary name of valsartan is Diovan. What I would be saying to the patient is make sure that their weight is hopefully coming down, and that they're doing a little bit of exercise. But what I would say, and this is very, very important, do not come off any of your medication without consultation with your GP. That's very important. I have seen people who come in and they've transformed their lives, and they're off, they've lost 3 or 4 stone, and they're feeling really, really healthy. And next second they come in and just tell me that I've come off the medication, there was no need for it. You cannot do that. You have to talk to your GP before you can do that.
Okay. Now, would you ask James why a person is always clearing their chest? It's very congested. And what would you recommend for it? It's a male. No health problems otherwise. No problems with their heart either.
Well, what I'd be suggesting there is definitely, it sounds like may have they could be allergic to something or have an intolerance to something, Jar. I would suggest that if they're on a lot of dairy, to come off that temporarily and maybe go on an antihistamine and use some carbocisteine. So you'll get carbocisteine in your pharmacy. You will get it under the brand of Expetex, and just get a non-drowsy antihistamine, and do that for a month and just see how that goes. So what we're looking at is Expetex, an antihistamine, and just come off the dairy for about 4 weeks
And see what happens. All dairy, would you say?
Yeah. Yeah. Well, not don't overdo
Don't be
it.
radical.
Like if you're on full fat milk, maybe come down to fat free or light milk. And what I would say there, Jar, if that is not going, they need to talk to their GP. Okay.
Lovely. Could you recommend something for pain in the hip?
Well, what we have to ask here, Jar, is the hip, has it been is it an injury that they've actually picked up? Is it something to do with the fact that they've had a hip replacement? So we need to maybe get a little bit more information there, Jar. Usually with pains in the hip, it's usually that there can be an issue here with the ball and socket joint. If that's the case, it needs GP intervention. But having a short-term course of, say, an anti-inflammatory with a painkiller, say paracetamol and ibuprofen, so long as they're not asthmatic and don't have tummy issues, just for a period of a week, and see does that reduce it down. If it does, again, you need to be considering like what is actually causing this inflammation. So again, I'd be talking to the GP.
James, can you recommend something to relieve gas and bloating in my tummy? I've had a tummy bug since Friday last. I've been taking Stemetel since Sunday as prescribed by a doctor, but still cannot get any relief.
But just go through that again.
I will, yes, absolutely. It's bloating in my tummy.
Yep.
Now, I've had a tummy bug since Friday last. I've been taking Stemetel since Sunday as prescribed by the doctor, but I still can't get any relief. So in other words, there's gas and bloating in the tummy all the time.
I would, if they get a chance to get some Benefits Bowel Support, 1 sachet a day for 2 weeks, and use that along with some peppermint oil capsules. And you can continue to take your Stemetel on the recommendation of the GP. Okay?
Okay.
And that should get rid of and relieve down the gas and bloating that they're actually experiencing in their tummy.
What's the Stemetel doing?
The Stemetel, it's usually that's anti-sickness, Jar.
Okay.
And sometimes people can use it if they have a little bit of vertigo as well.
Okay.
So, but what I would say there is they can use that along with the Benefits Bowel Support and the peppermint oil capsule.
Thank you very much. A lady gets shocks from everything she touches. What would be causing this?
Well, that's interesting question, Jar. I believe it's something to do with static electricity.
And the time of year too,
And
I think.
yes,
Yeah, this time of
exactly.
year.
So it's not something I'd be worried about. All right. Sometimes what people do, an old wives' tale I've often heard is if they're suffering from that a lot in the morning, if they have a little comb and they brush
Yeah.
it through their hair quite quickly, it tends to desensitize the static electricity and eases that particular issue down. Now, that's like the science behind it, I think works, but it's definitely worth a try.
It certainly is
Yeah.
worth a try. A female with piles for the last few days externally, using sherry precrot. Is that right, James?
Sherry Proc, yes,
Yeah.
Jeremy.
Never had pain like it. Please, can James
Yeah,
advise?
I feel great empathy for that patient, and really what we're looking at here, Ger, is to prevent how can we prevent this from occurring? The Sherry Proc is very good. It comes as a suppository and a cream, and the use of them together, or the Sherry Proc suppository or the cream, will have a definite impact. But I would definitely suggest to that patient hydration and multifiber plus. Okay, and what that will do, Jerry, is it'll ease the passage when they're going for number two through the colon, and it'll stop, because when you're forcing, Jerry, the actual veins, they tend to pop out like grapes, and
Yeah.
that can be a real problem, especially in ladies. And what I definitely recommend there, increase in fiber, soluble and insoluble, and hydration will really help.
Is there also a danger that those piles sometimes can, for want of a better way of putting it, burst
Yes,
when
they
they're at
can.
this
You
point
get
if they're
bleeding.
very painful, and you get
Yes, you
severe
can.
bleeding?
Yes, you
And
can,
you
Joe.
panic then, don't you?
Yeah, you do, and you can see blood if you're going to the
Yes,
toilet and
yeah,
stuff like
yeah.
that. So it's important. The Sherry Proct is very good, Jar, and there's another one, Ultra Proct, as well. But use that until you find an improvement, and the will go down. The will go down,
yeah.
but it's important. I have seen real great improvements when a patient is taking the multifiber plus and hydration, and increase their water intake and definitely their fiber intake.
Would you have anything for cramps in the legs at night time?
We just mentioned it there, Ger, electrolytes definitely during the day. So take an electrolyte during the day, and maybe one or two magnesium in the evening time.
To do the job.
Yeah.
James, I have type 2 diabetes, and I'm on a cholesterol tablet. Just wondering if it's okay for me to take a magnesium supplement as well.
That's an easy one, Ger, 100%. Absolutely, no problem at all.
100% yes to that.
Yeah.
Okay. James, all my joints have flared up. I'm in a lot of pain. I'm not on any medication. I'm only taking Panadol for this.
Well, it would be interesting to know why they
Why?
have flared up, Ger. You know, are they on a medication, or is it a virus they've picked up or whatever? But I definitely recommend there now some turmeric or curcumin and some selenium. Okay, because if it is viral by nature, the selenium is quite effective
Right.
at reducing down the viral load. And then if we use something like a natural anti-inflammatory like curcumin, that should actually give them some sort of relief. They're only taking Panadol, Jared.
Yes.
It may be an idea there as well. Maybe they could use something like an anti-inflammatory like ibuprofen, just for a short period of time, and obviously going through having a chat with the pharmacist.
Okay. Now here's a perennial one anyway. Any suggestion, please, to help someone stop snoring?
The only thing that I have seen working for snoring, Jar, is where people lose a certain amount of weight. And what that does is it seems to lose weight from underneath the chin area, Jar. And it seems to have a very positive impact on snoring. I know there's these things called HPAP, which are quite effective as well in people with sleep apnea that seem to have a positive impact on snoring. But ultimately, and there's rings and stuff like that. But what seems to have worked, and what I've seen people telling me, is that the loss of weight for people who are carrying a lot of weight in the neck area seems to have a very positive impact on snoring.
That's very interesting. That now we did deal with the liver in part 1, but here's a straight question as regards just a product to detox the liver.
The Benevis liver detox capsule, one at night, Jerry, for about 2 months. Very safe, very effective.
One at night. Shoulder pain since I had shingles 3 years ago. I'm in my late 80s.
Sounds like it's post-herpetic pain, Jerry. Very common, where the myelin sheath on the nerve lining hasn't improved, and it's very sensitive to, to touch, to whatever, and that can cause the pain. But get good results, Jerry, from omega-3 capsules and vitamin B complex for about 3 to 4 months. That's very important. I always recommend people who have had shingles straight away to go on that particular, You know, they may get an antiviral drug like Famvir or Zovirax tablets, which are very effective at stopping the virus. But the damage that the virus has done is a bit tricky, and that needs, because it's slow to heal, but the omega-3 and the vitamin B complex are very effective.
I have MS for the past 43 years. I now have hot flushes. Is this normal?
Well, is number one, is it a lady, Ger? Yeah, number two, she has it for the past 43 years. I wonder what age she is, Ger. You know,
Good question, but
that'll be a
one
good
would
question.
suggest
But
definitely minimum high 50s. Would you
yeah,
suggest, James?
yeah,
Like
it could be, Ger. I
early
definitely,
60s.
it would be something. That's a question I'd really like her to address with the GP, Ger, and I'd be
Right.
very curious of what they would come back with, or what they'd be suggesting, because I look after a number of ladies who have multiple sclerosis and are in that age category. So if that lady comes back to us, 096 60072, I'd be very, very thankful.
Perfect. Now let's go to Katie's question. Terribly tired all the time, and I'm ready to go to sleep when I'm just walking around. Can you please help me, James?
Well, definitely, Katie, just from that question, I'll be definitely recommending a good tonic, a good multivitamin tonic, maybe with iron. If she hasn't had her bloods done, and if she's not carrying too much iron in the blood, definitely a multivitamin tonic, the Vivioptil, the Benevit's tonic with iron for ladies, very safe, very effective, and use it for about 2 to 3 months. But don't be afraid either to get the other stuff right. Your sleep hygiene, make sure you get enough sleep. The other thing as well, your hydration and your food and exercise, very, very important, Ger. And I think one of the things that's come out of today's chat, Jerry, is, you know, the importance of exercise and that
Yes, very
triangle of
much
health,
so,
which
yeah.
is very, very important.
Great
So
phrase,
good
that, the
tonic
triangle
there.
of health. I
Yeah,
love that, the
thank you,
triangle of
Ger.
health. Now, James, I've a broken sesamoid bone, big toe. It doesn't want to go into the boot. Is there another option for me? Is the sesamoid bone in the big toe?
Yes,
Okay.
Ger. I'd be definitely recommending that patient, you know, to talk to their physio or podiatrist and come up with a plan there. Because do you see the problem? It doesn't want to go into a boot. Is that the healing boot, Ger? You know what people walk
Yeah,
around it, or is that the
a
boot?
regular boot.
The
Like
regular.
a
If it's
working
the
boot, yeah.
regular boot, you know, I'd be suggesting that they're going to have to be brave and stay away from the regular boot for a while. Now, obviously, if there's a health and safety issue there with work and stuff like that, they're going to have to review that with somebody in relation to how they're going to fix that. And either a chat with a podiatrist or a physio there may be able to help, Jar, you know.
Okay. Now I'm going to need your help here, James, because we are going technical. James, what do you think of, is it Montelukast Teva?
Yes,
Singular,
yep.
from mild asthma. The side effects are depression, psychological effects, and suicidal tendencies. Is there anything safer? I'm also on Symbicort inhaler and prokinetic motilium. Thank you, says Mary. Wow.
Well, Mary, my experience of Singular are very positive. Yeah. And with all patient information leaflets, they are going to give the full list of possible side effects down the line. I mean, if you were to look at the side effect profile for paracetamol, most people wouldn't take them. And that's not, I'm a big fan of paracetamol myself. But what I would say here to this lady is that Singular is it's very safe, it's very effective. I have seen it used quite a lot in mild asthma and also for histamine reactions as well. Purely from the side effects, these are collated, Jerry, from millions and millions of people that are using them.
Right.
So obviously there's always a slight chance with any medicine that you are going to pick up a side effect. But in the main, I've always had positive reactions with Singular. Is there anything safer? I think Singular is a very safe medicine, Jeremy.
Right.
I have to be honest.
Yeah.
The lady's also on Symbicort, so that will help the Singular and the Symbicort, which is used for asthma as well. So there's no reason, I think, and she should have a chat just to clarify it with her GP, but I think using the Singular will be a positive for her.
And what about the prokinetic motilium then?
Well, Jared, that's probably used for something else, like a tummy
okay.
upset or something
Yeah,
like that.
all right.
So there's no
Yeah.
issue there.
Yeah. James, how do you rate steroid injections for sore hips?
The general feeling about steroid injections is very positive. I was suggested, and I'll just as an overview, Jerry, to get an steroid injection into my heel.
Oh, yeah.
But the
spur, is it?
yeah, no, I'll tell you what it is, Jerry. It's where it's a facet joint in the actual. Now the podiatrist looked at it and says we're going to concentrate and exercise it for a number of months, and that seems to have eased it down significantly. But I had a steroid injection once in my for rotator cuff injury, and I had it once and it never came back. So obviously, if that's been recommended by the GP or the consultant, it's definitely worth exploring.
Okay. Now, James, let's move to this one. I hope I get this one right too. It's trochanteric bursitis bilaterally with gluteal tendencies. Just wondering, is there anything that you can take for this? You better just put that into plain English for me.
Well, I'll tell you what, Jerry, no more than yourself, I'm lost there as well. Okay, but what I'm going to say, if it is bursitis, usually that's you get bursa. It's a long, say for example, you get them in your elbow. Usually that's which you often find bursitis, where you get swelling along the lining. And there's tendonitis as well. So is there anything you can take for this? And thank you. Usually we'll be looking here at anti-inflammatories, but what I'm going to suggest here, Jared, seeing that it's the first time I've seen it, I am going to make a note of that question and we'll answer it. I'll either answer it in the next couple of days, or if the person rings 096 60072, we will look into that a little bit more closely.
Okay.
Is that fair enough?
Yep. James, I have a pain in my groin and it normally comes after I eat.
That's unusual, Jar. Yeah. I would be having a word there with the GP. Just something is jumping out at me there. I don't want the patient getting worried or anything like that, but I'd just like them to mention that to their GP. Because if you look at it, Jar, pain in the groin area normally after eating, I mean that's unusual.
Okay.
I haven't seen that before, and I just like a second opinion on that.
Another caller, I have fungal toenails for years. I'm too embarrassed to do anything about it. Do I go to a regular doctor or do I go to a podiatrist?
If you go to the doctor, Jared, there's loads of really good products out there that you can use. The only thing is consistency of use. There's a product called Loceral, which is very, very effective. You just paint it onto your nail, but you have to be consistent. And if you do that, it leads down those infections. Now, there is tablets you can get as well, but that needs doctor intervention, because you need to be minded, because I think the course is about 6 weeks, or is it 12 weeks? I can't remember, but you need, that just has to be, the liver has to be kept an eye on, Jar.
All right.
Now then, tablets.
We're back to the weight loss injection again. James spoke about it earlier on. Do you have to get that through a doctor's prescription?
Absolutely, Jar.
Absolutely.
I wouldn't be happy in any shape or form. And I know in the UK they're doing online, and there's a lot of talk about how people are actually getting, but it needs a GP minding that and minding the patient, because the body will be going through a lot of transformation, Jar. So if the patient is on, say, blood pressure tablets, if they're on different types of medication for the gut function or anything like that, that needs to be moderated. And the best person in the world to look at something like that is your GP,
who's familiar with your case.
Absolutely.
Could you recommend something for binge drinking?
Well, I would be suggesting to talk to someone, Jar.
As in a counsellor, is it?
As in, yeah, absolutely. And to sit down and have a conversation of why this is happening. Binge drinking, I mean, obviously if a person has gone out and drinking a huge amount, the damage that's doing to the system, both mentally and physically, is not good. And they need to sit down there and have a conversation with somebody professionally and see, is there some way that they can go about and manage this? Yeah.
A cure for arthritis in the big toe joint?
Well, definitely the use of short-term anti-inflammatories would ease down the pain, Jar, and to massage then the area with a good anti-inflammatory medicine, say like Diclac gel. And again, what we spoke about there previously, the ultra pure Epsom salt, and if you put a couple of scoops of that in and just keep the big toe in it for about 10 to 15 minutes, and
like a foot bath.
Absolutely. And then massage in the gel, that should give some relief there.
Perfect. And here's a caller, James, that's 24 in age with a sore hip, can't get to see their doctor for the moment. What would you recommend in the meantime? Just 24 years of age, they have a sore hip, they're waiting to see their doctor, so clearly they're waiting for an appointment as well. But could you recommend something for the pain in the foot in the meantime?
I wonder why is that, Jared? They have a sore hip and a pain in the foot.
Yeah, I'm just wondering, do they confuse themselves?
And that's a very good point, Jared. And what I'd be saying there, most certainly, is number one, it's very important that you see the doctor. Number two, pop into your pharmacist, have a conversation, and maybe explore the whole idea of using a painkiller, something like paracetamol, or a short-term course of Solpadeine in combination with an anti-inflammatory, and that should give relief. But at 24, a sore hip, pain in the foot, needs to have a chat with the GP.
Yeah, and take it from there. James,
Absolutely.
here ended today's lesson. Thank you very
Yes.
much indeed. We've worked your hard for the last hour, but thank you for it. 096 60072, of course, is James's number, and malloyspharmacy.com.
Yes.
You'll get more information there on the website. James, you're back next month with God's help. In the meantime, thank you.
Jerry, wonderful talking to you. Have a great day.